If you're planning on visiting Ecuador, there are some health and safety related updates that you need to know about. I am Ace, and to start with, let's talk about the health updates. Currently in Ecuador, there are outbreaks of both tosferina, which is whooping cough, and yellow fever. Whooping cough, which through the process of this outbreak is that I'm learning that that's what tosferina is called in English, is an infection of the lungs and breathing tubes. It spreads very easily and can be serious. Yellow fever is an infectious disease transmitted by mosquitoes that bite mostly during the day. The common symptoms of yellow fever include a fever, muscle pain, headache, loss of appetite, nausea, or vomiting. As of the recording of this video, there are a confirmed 321 cases of whooping cough. 106 in Guayas, 52 in Manabí, 45 in Pichincha, and 30 in Santo Domingo, as well as the rest of the other provinces. The yellow fever, on the other hand, is more concentrated in the Amazon region of the country. The main provinces included here are Sucumbíos, Orellana, Napo, Pastaza, Morono Santiago, and Zamora Chinchipe. Due to the outbreak of the yellow fever, Ecuador is requiring travelers from certain countries to have the vaccine against the yellow fever. These countries include Peru, Colombia, Bolivia, and Brazil. And remember, this includes if you are a citizen of these countries or if you just happen to be visiting these countries for a certain amount of time. To be specific, anyone who is visiting Peru, Colombia, Bolivia, or Brazil and has been there for more than 10 days in the process of visiting or going to Ecuador, then you need to have this vaccine. Specifically, you have to present an international certificate of vaccination against the yellow fever starting from May 12th, 2025. And if you're wondering what the certificate itself should contain, it is as follows: the vaccine or prophylaxis details, the date that the vaccine was administered, the signature and professional qualifications of the supervising clinician, the vaccine manufacturer and batch number, the certificate validity dates, and the official seal of the center that administers the vaccine. And keep in mind that even if you didn't come from Peru, Bolivia, Colombia, or Brazil, that you still need this vaccine if you're planning on visiting the Amazon region during this time. And also that vaccine must be administered at least 10 days before visiting the Amazon region. In regards to the whooping cough, it is considered to be more deadly and dangerous to children, but it is recommended that all people in Ecuador take the following precautions in order to avoid the spreading of the outbreak. First, wash your hands frequently with soap and water. Second, use alcohol gel when you don't have access to water. Third, cover your mouth and nose when coughing or sneezing, which should be obvious. Fourth, maintain physical distance from people who have respiratory symptoms. Fifth, do not self-medicate. Sixth, wear masks in areas where there's a higher contamination. And seventh, vaccinate all children from birth to school age. As a personal recommendation, even if you're planning on visiting Ecuador without children, I do recommend that you bring a face mask from wherever you're coming from or to buy one here. This way you can avoid getting the infection yourself and can help stop the spread of this infection, and you can also stop yourself from having a terrible time here because you got this infection. And currently there does seem to be some scarcity in regards to these masks, so I'll be leaving some links down below so you can bring some from elsewhere. And in regards to safety, I had recently heard that a level 4 do not travel was issued in Ecuador, but it pertains to certain parts of the country. Specifically, do not travel to Guayaquil south of Portete de Tarqui Avenue due to crime. Do not travel to the cities of Huaquillas and Arenillas in the province of El Oro, once again due to crime. Do not travel to the cities of Quevedo, Quinsaloma, and Pueblo Viejo in the provinces of Los Rios due to crime. Do not travel to the canton of Duran in the province of Guayas due to crime. And do not travel to Esmeralda City and all areas north of Esmeralda City in Esmeraldas province, once again, you guessed it, due to crime. Of course, the reason to not visit all of these places is due to crime, but to be more specific, as the travel advisory says, transnational criminal groups and local gangs regularly engage in violent criminal acts in these areas, including indiscriminate attacks without warning in public spaces. Violent crimes have included murder, targeted assassinations, armed robberies, bombings, kidnappings, and assaults, among others. Violence in these areas has steadily increased in frequency and brutality in recent months, posing an increased risk to US citizens. US government personnel are prohibited from traveling to these areas without prior authorization. As a result, the US government is limited in its ability to provide emergency services to US citizens in these areas. As for my personal thoughts in regards to the safety situation here in Ecuador, I'll use a reply that I made to a comment on one of my videos in order to help you understand what I think about safety right now. There's a weird safety vibe going around the country that I can't put into words at this moment, but in general, at the moment, and almost always to be honest, I feel it's more of an Ecuadorian safety issue, and not so much of a traveler issue. Like, if you're here for a little while, you probably won't see anything, but if you stick around long enough, you'll notice what's going on at certain times in the country. If I had to compare it, or give the closest example, it's like if you're in X state in the United States and nothing happens to you, but over in Y state, there's kidnappings and such going on. Sure, that would mean the states are dangerous, but more specifically, it would be that Y state, and maybe just a specific area of it, is dangerous. That's why the best thing you can do is pay attention to the travel advisory and avoid going to the places that it tells you to avoid going to, as well as pay attention to other media sources such as Ecuadorian news or YouTube channels such as this one that can give you a more realistic view into what's happening to certain parts of the country. I, of course, will be reporting if I see anything of substantial importance that requires reporting. But in the meantime, like I've said in various occasions, as long as you take the necessary precautions, as long as you use common sense, you should for the most part be okay visiting Ecuador. If you have any thoughts or questions, leave a comment down below. I'll make sure to answer as quickly as possible. Thank you for watching. Make sure you stay safe and take the necessary precautions. And as always, Ace out.